Father Nic, how worried should we be about Omicron considering what we're seeing, for example, in New York? I asked this earlier. And today there was a report of a spike in cases, pediatric infections, and they're attributing it to Omicron. And what's different now compared to last Christmas is our children are out this time, no?
Yeah.
How worried should we be?
So several comments on that. First, what is striking about the 4 Omicron cases that we've detected so far is that all of them were detected in quarantine. When we first detected the Delta, the Alpha, they were already in community transmission. So what is striking is that we have not yet detected any Omicron in community transmission. And given its doubling time of 2 to 3 days, once this arrives into community transmission, if it is going to explode, we will see it. I mean, it's going to be our base numbers are so low that you have a spike of 20 cases in one of the LGUs of the NCR, and that will be a large dot, and then that will just keep increasing. Second thing we have to point out with the children. So in South Africa, they also noticed an increase in the number of children who were hospitalized. They pointed out that these were children of unvaccinated parents. That's the first thing we have to point out. The second thing is, even though they were hospitalized, most of them were not hospitalized for COVID. They were actually hospitalized for something else, and then they incidentally tested positive for COVID. So it is important to note that there is a higher number of hospitalized kids, but remember, they are unvaccinated. So in general, if you vaccinate everyone else and everyone else is not going to the hospital, just numbers-wise, you will expect to see more pediatric cases. But there is no sense yet that the pediatric cases are worse than Delta or Alpha or Beta. So, there may be more, but they don't seem to be worse. And since the basal clinical experience of COVID is already so low for children, it's not like we should be worried that all of a sudden our children are going to be very sick and dying.
Well, of course, sir, Father and Professor, we're seeing some numbers of concern here. The positivity rate has already doubled in a week, and the R0 is up by 49%. Is there anything to qualify here? Is there anything that we need to keep in mind here?
Let Guido can do that first, and I will respond later.
Right. Okay. Well, we're definitely seeing an uptick in the cases in the NCR, but I have to remind everyone that this is the same thing we saw last year. We saw an uptick in cases in the NCR. I'm not saying that it's expected, but I mean, with the holiday increase in mobility, it will likely drive, community transmission in some places. So right now, the risk level for the NCR is still at low risk. So, I mean, if we compare to last year, we were at moderate risk throughout the December. I mean, low to moderate. So it's still we're still in a good situation right now. It's something that we're monitoring. We are aware of the uptick. I mean, people are seeing it, and there's definitely an uptick in the positivity rate. There's no uptick yet in the hospitalization. So it's something that we just need to be aware of, and we just need to remind people to, practice minimum public health standards, and to, continue doing what we have been doing well in the past, get vaccinated and stuff. And I'm sure Father will add to that, especially the vaccination part.
Hi, Professor. But let me add this on it. I suppose we're not yet seeing the direct result of the Christmas break itself. Kasi may lag time reporting, and also we're looking at the incubation period as well. So hindi pa ito yung talagang Christmas week effect.
Yes, but Ed, but last year, I mean, the Christmas didn't really even have an effect last year. So it was the days leading up to the Christmas, which actually had the which caused the spike, and then during the holidays, actually, the number of cases decrease, and that's what we're seeing now because of a reduced number of testing. And then by January 1st, when testing will resume, there will be an artificial spike again.
Okay.
This is what we're expecting. So what we don't know is what will happen after the first week of January. If this is just a holiday uptick, it should just decline back to the same level, around 200 to 300 cases per day, or maybe even at a plateauing value of 400 cases per day.
Ay,